Public Health Ambassadors Uganda, with support from African Women's Development Fund, has been running an HIV and stigma campaign for a period of 1 year called Wamu Nawe, and the Wamu Nawe basically comes from a local language that means working together in unit or supporting one another in all kind of situation.
It is a name that identifies very clearly with the ordinary citizens of Uganda.
And this name was generated during community consultation with the different women groups within the selected communities.
Title gye twawa ekibiina yali nnungi nnyo kubanga etugatta wamu abalina akawuka n'abatakola ki n'abatakalina. Kituleetedde okuba nti no tusobola okukwatagana mu ndowooza.
In the communities where we've been working, it's been evident that there is high stigma. So when I say high, it's just high because, you know, depending on what the community members say, because you go to a community, interact with them, and they say, oh, there's a lot of stigma in this community. People living with HIV will always be undercover. And then those who even want to test for HIV will not easily access a service because they fear to be discriminated against in the event that they are found HIV positive.
When people realize that you're HIV positive, they will not come to you and confront you, but they will go behind your back and start talking about you. That is one of the major challenges, basically. But then the other challenges are people don't want to be with you, they don't want to share with you their stuff. So when I was in high school, it was a bit hard because I was in a boarding school and people didn't want to share with me stuff because they realized I was positive.
The major goal of this project was to reduce HIV-related stigma and discrimination among women and girls, and this was to foster full engagement and participation in social and economic development of their communities. This Wamu Nawe project had 3 objectives, and one was to increase knowledge and awareness on issues related to HIV stigma and discrimination, the different forms, types and trends related to HIV stigma and discrimination among women and girls infected and affected with HIV/AIDS. The second objective was to increase access to quality HIV care, treatment and management among young women and girls within the selected communities. Then the third objective was to increase income levels among a selected number of women and girls infected with HIV within the selected communities in Wakiso and Kampala district.
Kati twagala ntufuna omusomo n'ekitongole ekiyitibwa Public Health Ambassadors Uganda ne batuyigiriza ebintu ebyenjawulo naddala ebyokulwanyisa akawuka ka mukenenya, ne batuyigiriza ebintu bye tusobola okuba ne bizinesi zaffe era ne tuziyimirizaawo ng'okubala ebitabo byaffe ennyingiza n'enfulumya, okumanya ssente mmeka z'otaddemu n'ezoggyemu, ne tuyiga okukola shampoo onaanaaba mu nviiri, ate ne tuyiga n'okukola paper bags. Kati bwe navaayo nga ndaba ebintu bino birungi ne ngamba nina obbiza mu gurupu yange. Gurupu eno erimu abantu 102, abaami n'abakyala, abavubuka n'abantu abakulu, era nga abamu bayina n'abatalina kawuka ka mukenenya.
Era bwe twasomesebwa mu musomo okukola amabaasa ne shampoo n'okubala ebitabo, nze na concentrating nnyo ku mabaasa olwa business gye nnina. Era expenditure y'akaveera sikyagifeesinga kubanga neekolera amabaasa agange ate nengeekozeseza.
Omusomo naguyigamu ebintu bingi, naye ng'ekimu kyo kye nasinga oconcentratingako kyali kya kubalansinga bitabo. Kuba twalina project y'okukolanga cookies naye nga tetumanyi, oluusi tetumanya ssente ze tutaddemu, naye nga tusanye essira ku ze tujjamu, kati natandika okukibalirira.
Stigma and discrimination is purely about lack of knowledge about HIV, and also it is born based on the African traditional way of looking at diseases, most especially these long-term diseases that we have in our communities.
People are ignorant, people are not informed, people are not aware of how to handle people living with HIV. That is why stigma is on the rise.
Children who are born with HIV have also reached secondary and institutions where they may face serious stigma and discrimination in whatever form. And having the peer educators would impart skills and knowledge on fellow students or fellow peers to support and embrace those ones who are HIV positive.
The reason why we thought we needed to have peer educators is because peer educators play a big role, especially in reaching out to the young girls and adolescent girls within the communities and in schools. Young people relate so much with one another, so they can be able to pass on information freely and share a lot of information and share challenges and experiences and skills on issues related to HIV, stigma and discrimination.
So the peer educators are that opportunity that the community needs, the same as the organization needs. So it is trying to help them close the gap.
Being a peer educator has helped me help the teachers and the students understand the meaning of stigma and how it is related to HIV. And by this, we have tried to see that students work together.
I've learned more about myself, self-awareness. I've learned that I need to understand myself first before I get to understand others.
I've learned a lot, like the way I approach the peers, because in many cases we approach while condemning, yet in actual sense we have to approach while relating, assimilating ourselves to those peers, in that they do not feel offended or they feel like they are left out. So I've learned that from the training, and then I've also learned to appreciate people the way they are.
So the peer educators play a very pivotal role in terms of bridging information and the people and bringing them together in terms of what? Streamlining awareness.
But the different workshops that we have had in the different communities have indicated that people actually tend to come out of the cocoon. If someone is HIV positive, they later realize that they are not alone, and they later know that being with HIV is not an end in itself. They realize that there is HIV treatment and that it is free of charge, and that they can access this treatment from different places within the community.
When women and girls remove stigma, we've seen people speaking up, talking about their disease without fear or favor. I know that removing stigma will result in easy testing and also getting treatment.
The project also oriented and sensitized some of the key stakeholders within the communities, and these are basically local leaders, and these included health workers, district officials, sub-county leaders, town council leaders, village health teams, both in Wakiso and Kampala, and they were empowered on issues related to HIV stigma and discrimination, and how best they can address issues related to HIV at a community level, conducting door-to-door sensitization, especially at the different forums within the community. Some of these local leaders have also played another role, have also dabbled in as HIV stigma champions, and they influence positive behavior change in terms of passing on correct information on HIV/AIDS and discrimination, and also mobilizing the community and encouraging the community to get to know their status, and also encouraging positive living.
Tugenda mu communities abantu ne tubabuulira nti nno bannange akalwadde mujje tubakebera omusaayi ne bajja free of charge, ne tubawa condom, ne tubawa ne free counseling, bafaayo okumira eddagala. Ate kati bwe tukola follow ups fe abali eno wansi olabira ddala ng'oli afaayo.
And of course, other services that were received during these community outreaches included family planning services, in particular HIV prevention measures such as condom use, and they were also educated on correct and consistent use of condoms, cervical cancer screening and breast cancer screening for women in their reproductive age.
Even here in schools, do not discriminate people living with HIV.
During school outreaches, Public Health Ambassadors Uganda was working with support from the school administration, the school health clubs, and the senior women and men within those respective schools. And these were very key stakeholders, especially in mobilizing students to come and attend these activations within the schools.
So how are you doing today? Is everyone okay?
We went to edutainment because that's one of our thematic areas. We use edutainment to inspire and motivate and to reach out to the youth.
So if we continue with these outreaches by showing them that even without just dialogues and counseling and guidance, there is also that point where you can enjoy and have fun while learning.
It is very important to have such events in school because they help our students to learn more about AIDS scourge and how to go about it.
All this was aimed to help students get the message on HIV/AIDS in a fun and an interactive kind of environment. This is because many of these young people relate so much with music, and this also helps the message that we're trying to pass on to them to stick in their mind because it evokes a lot of emotions to them. During focus group discussions, students had an opportunity to ask questions.
We discussed a lot in that they told us scenarios of their parents hiding that they're HIV positive until the age of 18 or until when they're adults and they find out from different places.
And many young people had an opportunity to confess and also change the mindset such that some of them are now key change agents within their respective schools, such that they can pass on positive message and accurate information on HIV/AIDS and discrimination.
I've learned how to associate with different people who are positive, and I've learned how to love them.
And I've also known that HIV, if you have HIV/AIDS, it's not the end of life.
Testing is normal, and living people with HIV is normal.
This project has been very, very key, especially in increasing visibility and publicity in regards to our work as Public Health Ambassadors Uganda. It has strengthened the work with other stakeholders, and also it has also empowered the staff and the people that work at Public Health Ambassadors in terms of project management, in terms of implementation of key activities, in terms of advocacy, in terms of human rights and gender mainstreaming in issues related to HIV/AIDS.
We launched a song, Wamu Nawe, that implies we are together with you, as a song that puts us together and unites us, both the AIDS-affected people and non-affected, that we can support each other in every situation, whether positive or negative.
The project has also had an opportunity to establish strategic partnerships with a number of community-based organizations within the respective communities, and working with civil society organizations such as Uganda Cares, Uganda Network of Young People Living with HIV, working with Peer-to-Peer Uganda, as well as working with corporate companies such as UAP Insurance. And these have also been very key in supporting the project during implementation, and also providing sustainability on some of the activities that will be ongoing.
And a lot of these networks have been, to a large extent facilitated by the grant that was provided by the African Women's Development Fund.
And I want to take this opportunity to thank African Women's Development Fund, and we also look forward to working together in the future on other projects.
It would be good to have this project expanded specifically to young women. I know we have been targeting women and girls, but Increasingly, it is clear that there is a lot of widespread stigma and discrimination amongst young women and adolescent girls. So if we are to reach out to this particular population subgroup with services, then we need to ensure that there is less or no stigma and discrimination. And with that, we definitely need to have special focused interventions for young women and girls.
So I would like for women and girls to be confident and to remain empowered, to see that the end of AIDS happens in our generation.